we trialed them, and then we assessed them using that rubric that I was telling you about. And what we found was that none of them actually had any kind of like clinical data to support their use. Now, that doesn't mean that previous research hasn't done the same where they've downloaded the app. However, there's no official study that has used the app to see whether it directly was related to any of the health outcomes that I've mentioned. So that's one of the things that we noticed is that we don't know whether these apps that are in the public space are effective.
Welcome to Beyond the Wheeze, the podcast where perseverance meets potential. I'm Josh Realm, public speaker, marathon runner, asthma advocate, and your host as we explore the intersection of health, fitness, and resilience. Whether you're managing asthma, chasing a new personal best, or simply looking for inspiration, Beyond the Wheeze is here to show you that no challenge is too great to overcome. Together, we'll uncover stories, insights, and strategies to help you push beyond your limits. It's time to breathe deeply, move forward, and unlock your true potential, one step at a time. Today, I'm excited to welcome Dr. Shirley Quach to the show. Dr. Quach is a respiratory therapist with a PhD in rehabilitation sciences and a leading researcher in digital health for respiratory care. She is currently the Director of Person-Centered Care and Programs at the Lung Health Foundation, a project investigator and clinician scientist at Sick Kids Hospital in Toronto, and an assistant clinical professor at McMaster University School of Rehabilitation Science. Dr. Quach's clinical experience spans all ages, from neonatal to older adults across acute and critical care settings. Her research focuses on evaluating respiratory therapies and interventions, with a particular interest in mobile health, or mHealth, applications for asthma and COPD self-management. Before we begin, a quick note. This episode is for educational purposes only and not medical advice. Always consult your healthcare provider before making decisions about your care. Today, we'll explore the role of apps in supporting people with chronic respiratory conditions, their effectiveness, and what the future might hold for digital self-management tools. With all that being said, Dr. Quach, welcome to Beyond the Wheeze. Thank you so much for joining me.
Yes, thank you, Josh. I'm very happy to be here. I'm very excited when you reached out to me to talk about this topic.
Yeah, well, I think we met maybe about a year ago now. Now, we did get a chance to meet up on May 5th, I believe it was, at the Lung Summit in Toronto. We were both presenting and you were doing your presentation on mHealth, essentially these apps on COPD and asthma. And I thought it was fascinating and important as well, because you don't really know what you cannot trust out there. There are a lot of mobile apps that claim to pretty much be a one-stop shop, and I don't think that's the case. So thank you so much for coming on, and I hope we can clear the air on that.
Yes, for sure. Thank you for that.
So I'd like to start off with reflecting on a research journey. Dr. Quach, your career bridges clinical care, teaching, and digital health research. Looking back, what inspired you to focus on mobile health and app-based self-management for respiratory diseases?
Yeah, that's a great question and an interesting one. I always tell everyone that my path was not straight. Like, I didn't go into university thinking this is where I will be. But after I had finished my undergraduate degree, I went into respiratory therapy. And then I started my practice as a respiratory therapist. And the reason why I did this was because I really was passionate about research. But at the time when I finished my undergraduate degree, I felt that I needed to have some clinical background to really understand what it means to do health research. So then I did my diploma in respiratory therapy. I practiced, and it was, I think, sometime in 2018. I was working on the wards in a hospital. I had a requisition to go see a patient who was admitted for a COPD exacerbation. And I remember going to him and having a conversation with this individual, talking about COPD, why it was important to self-manage and why it was necessary for him to continue to take his medication, be aware of the triggers, the signs and symptoms. And then at the end of that conversation, he asked me, can you just recommend me an app? And it kind of took me aback because that was not something I was expecting him to ask. But at the same time, at that point in time, I said, I actually can't recommend you anything. I actually don't know. And that was the truth. You know, being a clinician, I'm very mindful about what kind of information I give to my patients and clients. I said that I couldn't recommend him an app. there are, health organization that has information that he can refer to. And that's what I said. But then that kind of piqued my interest because as you imagine, in 2018, and then the pandemic that occurred a couple of years later, digital health has really picked up, and it has been a very interesting topic in the health system and the health discussion and research world, because we want to know whether, digital health and these different nice tools and technology can really help facilitate some of the conversations that we have with patients and clients, but can it really help us in terms of making decisions in healthcare and health management? So that really stuck to me, I would say, when this patient asked me about it. And then I think part of it was that was always at the back of my mind. And a few things led to another. Somebody said that I should probably continue to pursue that question. So I actually had done a, a narrative review, which is kind of a synthesis review, just to see what was available out there. So this was around in 2019. At that time, that was, again, still relatively new. There wasn't much on it, but there was a lot of traction in the research world. It wasn't probably until when I was working during the pandemic, and then I had met Dr. Dina Brooks, and I had this idea to talk to her about I'm so interested about mobile apps. I want to know whether it's actually helpful or not. And she's like, she recommended me. She's like, why don't you do a PhD on it? And so I did. So I did that. And that was kind of really the focus of my thesis, was to understand whether mobile apps has a specific role in people's self-management, specifically in COPD.
It was very thorough as well. And of course, for the listeners, I'm going to link that in the show notes if you're interested in reading that. Your clinical experience spans neonatal to older adult care. How has working with patients across such diverse populations influenced your research focus and approach?
Yeah, that's a good question. So when I finished RT school, I wanted to know where I could work, essentially. Our RT has the skill set. We really focus on respiratory health, but that wasn't limiting in the sense that I didn't have to specifically work with a specific population. So I thought, why not explore it? See where I could go with this. So I did work in a variety of different clinical settings. I've done pulmonary function testing for a small period of time. I've also done CPAP clinic. But a lot of my focus and time was actually in critical care. And critical care expands from, emergency room department, and then to wards, and then also in the intensive care unit. And I've worked in NICU, ICU. In fact, I worked a lot of my time during the pandemic in the adult ICU. And it wasn't until midway through the pandemic that I transitioned into PICU. I would say all of my clinical work really informs my research, because I can see clinically, what are the clinical gaps? Because we talk about these clinical gaps during doctors' rounds, right? When we as an interprofessional team talk about treatments and next steps for our patients and clients. And so a lot of the times we review those and talk about, what's current research, what can we do? There are clinical practice guidelines that we use to help direct our practices. And all of that is based off of research evidence that is well known. And so sometimes there are gaps and there are still questions. And then that really informs some of the work that I get interested in. And so I would say the PICU stuff is really what really triggered my interest in pediatric recently, is because I have been working in the PICU. But I also met Dr. Mika Nonoyama. So she was my master's supervisor, and she really encouraged me to continue on that pathway with research. And so she has a portfolio in pediatric health, as you may recall, and she really encouraged me to really think about some other things that are different. And doing research in children is interesting, right? Because when we talk about children is we say under the age of 18, right? But a person who's 17-year-old does not look the same as a 5-year-old, right? The size, the height, weight, all these things are not the same, but then they're all classified as children, right? And so that was very interesting. So in terms of knowledge gaps and research, that is a big, wide area that has really piqued my interest. So that's kind of where it has led me to now. This is why I'm at Sick Kids, for that reason. That even for me, when I see patients coming through, for example, the ICU, a 5-year-old in this room does not necessarily look like a 5-year-old in another room, and part of it is because they have different um, background, like your health history, different health history, and environmental factors. But those are all things that are very interesting to me, right? Because we all walk and live different lives, and I think those are all important factors that we have to consider. But at the same time, we want to do it in a very strategic, controlled way so that we can actually find these specific factors or influencers to some of these health outcomes that we look at.
Across all your research from apps to asthma biologics, what has been the most surprising insight or finding about supporting patients in managing chronic respiratory conditions?
Yeah, so kind of different, but kind of not, because both of them really relates back to, like you said, chronic disease management. And so I think with any disease, whether it's an chronic respiratory disease, there are multiple pieces to it, right? Like a wholesome health management of a condition requires many players, many interprofessional players at the table, and the person who's living with that condition themselves to be involved. And I think that's kind of important when we talk about that, where you're looking at mobile apps. I think that's more so of a self-management component to somebody's chronic disease. But then if we're talking about biologics, these are things you can have a conversation with their healthcare or your healthcare team to decide whether that is something that is a fit for you, right? Just because it works for somebody doesn't always works for everybody, but that doesn't mean that we're not using, research or evidence to make those decisions. So I think that's very important to have those conversations. Everybody's kind of, I would say, the puzzle pieces are slightly different for different people, right? And we have to remember that. And Dr. Teresa Toh mentioned in her podcast about her podcast episode about precision medicine, right? Is really targeting and being very specific for the needs of the person who has a chronic condition.
Yeah, absolutely. And for those interested in learning a bit more too, I'm going to link that at the bottom. Okay, before we move on now, we're going to talk a little bit about mHealth. So to answer the question, what is mHealth? For those wondering who do not know, mobile health or mHealth refers to health services and information delivered or enhanced through mobile devices, including apps for tracking symptoms, medication reminders, or digital education tools. Studies suggest mHealth can support self-management, but as Dr. Quach pointed out, it is not a replacement for professional care. So now I'd like to move on to part 2, which is evaluating mHealth apps for COPD and asthma. In your PhD and published studies, you evaluated publicly available COPD apps and conducted systematic reviews. Can you walk us through your main findings on app design, features, and overall quality?
Yeah, so it's great that you brought up the two sides of it. So there is the apps that are available publicly, and then there are apps that are published and written in trial studies that are published in research journals. Overall, between the studies that I've done for my PhD, it was generally inconsistent all around. And let me talk a little bit about that. So how I went to approach to evaluate these apps in the published work and in the public domain is by using an evaluation framework. So kind of like a rubric. And in that rubric, there were 5 specific categories. So app accessibility, we're talking about their design. Are they available on the Apple App Store, Android Store, or both? Is there ability to increase the text size? Some of those accessibility features that a lot of websites have now. The other category is privacy and security. So is there information about how the data, if it's going to be entered into the apps, how are they going to be used? How is it secured? How is it going to be protected, from third-party users, things like that. Another category was the clinical foundation. So is it credible? What was it made from? Was it informed by research or previous work? The fourth category is engagement style. So we're talking about features, input and output features, and then therapeutic goals. What is the main point of these apps? So, in the published studies that are available in research journals, a lot of these studies really focus on evaluating the effectiveness. Now, when you publish a research journal, it's a lot of journals actually require that they are reporting their design and creation of their data in a systemic way. So usually there's like again another type of rubric or guideline to support authors when they write their studies to make sure that they're hitting all the main points. However, the thing is about digital health and mobile apps in general, there's no real guideline and there's no real enforcement in ensuring that any type of research article that is published about digital health or apps are following this guideline. So again, these are guidelines. We recommend them, and some people don't know that they exist. So that kind of allows for research studies to be published and outlining different things. In terms of the published studies, going back to what I was saying, that a lot of them reported the effectiveness of their apps. So they talked about their features, what did they include in the features, and whether there was changes in the user's outcomes. So like, for example, did they improve on their medication adherence? Did they improve on their symptoms? However, there wasn't a lot about, for example, back to those categories that I mentioned about app design. So was this app available on the Google Store or the Apple Store? What about the information that the users were entering into the app? So that's kind of like a little bit of a mystery. It's not clearly defined. But in terms of the features that have been reported in published studies, a lot of them are education. So education is a big one, and they are delivered in various formats. So videos, written information is usually common, and then there's reminders. So reminders for appointments, reminders for medication. Then there's also the ability for them to do goal setting, diary tracking, symptoms tracking. And then another component that I've noticed is not so many of them, but some of them provided that ability for users to connect with their healthcare providers. So they can text, do calling, for example, but all of them required that the apps are used for that study. So that's why a lot of these apps in those published studies are not available in the marketplace right now, for the reason that when people enroll into these studies, they are carefully monitored, right? And people who are using it are in contact with the research team. So all of these apps that were published in research journals, I did not find them on the marketplace. So they're not publicly available. And the thing is it's really hard to pinpoint which exact feature is the one that really helps and improves people's outcomes, for the reason that each of the different studies created their apps independently, but then also they had different combinations of features, right? So without being able to know the exact feature or isolating them, right, it makes it difficult to make that conclusion. In the case of publicly available apps in the marketplace, so these are the ones that are available on the Apple Store and then on the Google or Android Store. Some of them are not actually available on both platforms, which I found very interesting. And then there was also a lack of clarity in terms of where these apps came from. So for that particular part of the study, what had happened was that I had my research assistant and I had gone onto the Apple and the Google Play Store and looked up apps for COPD. And then we downloaded them, we trialed them, and then we assessed them using that rubric that I was telling you about. And what we found was that none of them actually had any kind of like clinical data to support their use. Now, that doesn't mean that previous research hasn't done the same where they've downloaded the app. So there are studies out there that have downloaded the app and then assessed it in their study. However, there's no official study that has used the app to see whether it directly was related to any of the health outcomes that I've mentioned. So that's one of the things that we notice is that we don't know whether these apps that are in the public space are effective. And then some of these apps in the public space, it's not clear where they came from. So we talk a lot about credibility. Some of them is very clear where the app was created by like a health organization or a health association. So those ones are clear. You can believe that it's credible because there are documentation to link to and describe like how the app came to be. But for the majority of the apps on the Apple Store and Google Store, there's no information on that. And it's not clear as to how these features came to be. Now, the other thing too, when we talk about features in these public apps, again, same thing, they're inconsistent. So one app compared to app number 2, their features are different. But I will say that the education piece is still a very common one, where they provide video or written text information about their disease. We have to still, again, just be very careful about that piece because it's labeled as education. But if you're unsure where this information or app is being created or who created the app, there's that potential misinformation, right? That we talk about, that we don't know where this information is being sourced from. And some of the other features that we noticed in the public apps were, for example, surveys, diary logs, reminders for education, some action plan, I believe. And then there were a very select few that had connection to peers. Again, features were inconsistent across the board. And then it's not clear whether these apps are actually helpful to people with, with COPD. And if you look in the app stores too, you can see that there are hundreds of downloads, but there's no app store ratings. But in a way, it's a little bit scary because so many people can access this information, yet at the same time, not all of them are from credible sources. And some of them you can't even find who were the original creators of the app.
And certainly in a time and age where misinformation is rampant, right? It's difficult to know where to really put your attention towards and what you can rely on. So thank you, Dr. Quach, for going through that. I would like to outline some statistics from your research as well. So 13 publicly available COPD apps were evaluated. Common features, as you pointed out, symptom tracking, which all of them had, education, which all of them had, and medication reminders, which about 85% of them had. Only a few apps, though, included privacy or security details, and none had strong clinical evidence, which is certainly a problem. You also looked at interactive apps studied in controlled trials for both COPD and asthma. How did these differ from publicly available apps, and what lessons can clinicians and patients take from this research?
Yeah, so this kind of touches upon what we discussed earlier, that a lot of the apps that are available in the Apple or like Android store, you have to be very careful, right? You want to approach it with caution, in the sense that in a way, anybody could create an app and upload it onto the app marketplace. So in terms of choosing an app, if this is something that you want to entertain, you have to be very careful to determine whether the app you're going to use comes from a reliable source, like a credible organization. So for example, if there are like a health organization that has created an app for a specific disease, that would be obviously much more credible than if you were to look up an app that has high ratings, but then you're unsure where the app is actually made or who was involved in creating this app. And I think one of the things to really remember about apps is that the apps is really for the person with the lived condition, right? Like it's really nice that if a clinician is really interested in it, but if your client or your patient is not interested in it, it's a tough sell, right? And again, back to the point that apps are supposed to be an adjunct, right? Like you're not supposed to rely on it so much in the sense that, it's going to replace what you're going to do. It's supposed to facilitate. And this is what I really strongly believe about digital health as a whole, or any sort of digital technology, is that it's supposed to supplement what you're already doing and to facilitate and really improve in a way the workload that you may have, right? So for example, the example that I always give is that sometimes maybe people who have to take daily inhalers, it can be burdensome for them because sometimes they just might not forget and they're not consistent. So then an app, for example, might be helpful in like reminding them to do that, right? And then app selection really depends, not only depends on the credibility, but really depends on what you're looking for, right? An app that only is solely for education is not helpful to a client or patient who's actually interested in, again, getting those interactive features for example, symptom tracking or medication reminders, right? So each app has different capabilities, I guess, so to speak, and you have to find the one that fits. And to do that, you have to make informed decisions, right? And that's from both parties, the clinician side, but also the person with the lived experience. And that's kind of what I've come to, in a way, realize when I was doing my thesis is that it's really, again, the digital technology is really helpful to facilitate, but both sides, whether, the app is on the public marketplace or even the apps that we're trying to, standardize through lots of research studies, is that you have to continuously have that kind of engaging conversation from both sides to see whether that is something that is going to facilitate not only the patient, but also with the clinician. Because like, what is the clinician going to do for the client if we integrate mobile apps? The other thing to be very mindful of that I think that we don't talk much about is talking about the dynamic nature of technology, right? An app you download today is going to come back with lots of, so to speak, updates, right? There's always consistent updates. And that's the same thing as research and health information. There's consistent changes. There's always new information, new evidence comes out. But one of the biggest concerns with some of these public mobile apps that we found was that some of them haven't been updated for over like 1 year, truthfully. And in the grand scheme of things, when we talk about digital information, like last week is technically outdated, right? So if you're going to pick an app that's not been updated for over 6 months or even a year, let's say 5 years, that's pretty alarming. And that's probably not something you want to integrate into your self-management routine or even consider that as an adjunct. And I think that's also another important piece of the entire, like the puzzle of when you're trying to decide whether digital health or even like mobile apps is something you want to consider in like your overall formula in figuring out how to manage your chronic condition.
I believe it was just shortly before hearing your presentation at the Lung Summit in May that I had a creator of a cloud source app reach out to me and asked to essentially be on the podcast. I did a little bit of research, but certainly after your presentation, it definitely had me second guessed. And I just didn't quite know at that point if it's something that I can get behind and support without really knowing more behind it, really. So I decided maybe not at this time, maybe down the road. But your presentation certainly helped me. And I know we had this discussion before.
Yeah, I'm glad. And it's all about making informed decisions, right? It's not so much like a yes or no. It's not black and white when it comes to disease management. It's really being able to empower patients and clients to really think about what really works for them, right? To me, I'm talking from like in a way my clinician hat, is that what's very important to me is what works for my clients and patients. If apps is not the answer to it, which it's fine, it's true. Sometimes it's just not it. That's absolutely okay. But that doesn't mean, that we don't talk about how we can ensure you're still having that success without that tool, right? Again, apps are supposed to be a tool. But at the same time, if this is not a tool you want to consider, that's okay. But we still can't, let things be missed just because you think the tool is going to be my sole medication reminder, which is not the case, right? It can help you with medication reminder. This is just an example. But, if you don't want to use an app to remind you about medications, then, hey, we need to figure out a schedule for you to always remember to take your medication because that's very important for your disease management.
Privacy, security, and regulatory compliance were inconsistent across apps. How should patients and healthcare providers approach these risks when selecting an app to use?
Yeah.
If that's the route that they choose to go.
Yeah. So this is very important, privacy and security and regulatory compliance. So in terms of apps, most of the publicly available apps right now for COPD that we assessed had some sort of privacy privacy pamphlet, before you click that checkbox, like I agree to everything, they're supposed to outline what they're going to use that information for. really understanding how that data is going to be collected and what can it possibly be used for. I think this also ties in closely, though, with what that app is going to do and what that app will serve the purposes for. So, if that app is, for example, much more informational, where it's providing you resources, external resources to like videos or written information, and they're not actually collecting information from you, then that might be a different case. Whereas if you are inputting information into the app, right? And if you're concerned about privacies and your privacy and security of your data being inputted, then that's something that you need to consider before you have, input it in there. The other thing too is that you have the option when you're using some of these apps, and they should be when you enter into these apps, whether they can get access to like your camera, your microphone, geolocation. So those kind of things you need to really look out for when it comes to like the privacy and security pieces. I think those are the main key points when you're looking at selecting an app. And again, that goes back to like, what are you planning to use this app for? If it's credible and you think it comes from a good source and that you really think it will be meaningful for your overall disease management, what kind of information are you putting into there? Like, are you going to be putting in a lot of like personal reflections and things like that? Or are you going to put in some of your medical information? I think a lot of the current apps right now on the public space they're not equipped to do much with that medical information. So that's not something that I would, put into an app. But for example, some of these apps may have questionnaires or surveys, which is like, rate on a scale of 1 to 5. If you're comfortable, using those scales and it's not collecting anything else, I think you can use it just objectively, almost like an anonymous user. So again, it's really looking at that privacy and security policy that they have, and please read it. Like, definitely read it. What is it asking to get access to before you enter anything into the app? Or in fact, before you even download, see and security information and policies are available before you even hit download on these apps. So I think that's also one of the things that sometimes we overlook when we're browsing on the App Store, but that's definitely something to consider because this is your information. And especially when it comes to health, I think it's very important that we are seriously taking a look at this before you consider using any of these types of technology.
I couldn't agree more. And I think we're all too quick to, do that scroll and accept the agreement right away.
Yeah.
Always important, especially when it, involves your health, to read those thoroughly. So thank you for all that information, Dr. Quach. Based on your research, what features or design elements make an app truly clinically viable and effective for someone managing asthma or COPD?
Yeah. So my thesis had multiple parts to it. So you mentioned the piece that we talked about was the systematic review, and then we had the evaluation of the public marketplace, and then there was one more component to it. So after we did the public marketplace evaluation, so this was my research assistant and we actually took those 13 apps and we presented it to clinicians and people with COPD to give us feedback on it. We didn't ask them to download the app. We actually downloaded as a research team, and then we created like almost like an infographic for them to browse and view to see what it's like to use the app. And so that was very interesting in a way because we got some pretty good perspectives from that study. And funny enough, as I was saying, it's very important to, the maintenance of this is very important because in the study that when we did the evaluation, you said that we had 13 apps. You're correct. We had 13 apps. By the time we moved to this last part of the study, we can only actually reassess or reaccess 10 of them. So I only presented 10 of them to my clinicians and people with lived experiences. And what they came back to us when they did their assessment after looking at the infographic was that they had different ideas. Not only in the features, but they also had different ideas as to how they can integrate it into their disease care plan. So if we start with people living with COPD, a lot of them really appreciate that kind of information. I think it's never wrong to have too much. In a way, it's never wrong to be more educated, right? Like to learn more about their
Mhm.
disease. And I think sometimes we forget that when somebody gets a diagnosis, or even if they've had this diagnosis for a long time, it's nice to still be, you know, in a way, re-educated and learn about their disease, right? Because things change in the sense that there's always new evidence coming out, but at the same time, is a good refresher, right? What it means to have this disease and why it's important to, take control of your disease. I'm a strong believer that, if we can find the right formulate, like again, the management formulate, people can really still live, their lives without being burdened by their disease. So education was a very big one in the people with lived experiences. They talked about how like education through videos, through resources, like written resources, and being able to look at external resources, not only just within the app, but if the app can link them to other educational information, they really like that, right? Because they love to read about it and see the different type of information being presented. And I feel like sometimes we forget that like one person can present information this way and another person can present it another way. It's the same information, but they're presented differently. Sometimes some people just resonate better with one person more than the other, right? And the example I always give is that I can sometimes relay the information to my students in the classroom, and you can see they don't get it. But then if I tell my senior student to relay the same information, for some reason, the light bulb goes up, right? They're like, oh, yes, I get it. But the information was still the same. Like nothing has changed. It's just the person who said it was a different person. And so in ways, right, there's many different ways that people like to absorb information. And I think we sometimes forget that, right? It's not just written information. It's not just videos. So there's different ways to present information. And I think people with lived experiences really like that, to have that education where they can kind of pick their choose your own adventure as to how they will learn
Mhm.
about their disease and why it's important to, manage their disease. So the education one was a very big one. And then I think some other things that were kind of important to people with COPD, what they've highlighted is that, sometimes I'm pretty good with my medication reminders. I don't really think I need that. So I don't want an app that's always going to be like, in my face, like time to take your medication. It's time to take your medication. So, that kind of notifications, I guess is the correct term for it, is they are not interested in it. And they're like, I wanted to have the option to turn that off, right? I want an app that allows me to have everything that I should have, like everything I should have for my disease management, but I want to pick and choose exactly, which features that I will engage in. So like more of the education. Maybe I might need the medication reminders in the beginning if I start a new, regime, but then after that, I don't want that. Right. So there are multiple features, but I think one of the key pieces that was really emphasized to me by people with COPD was that I want an app that's not going to be overwhelming. And it's not so much of the ease of use, but more so of like bells and whistles are nice, but sometimes it's just too much. I just want it to be a part of my life and it's supposed to help me. I don't want to have like added stress. Right. So I think that's a really key piece in that regards to empowering people to really take charge of their disease. And I think they're right. Like they should have the option as to choosing which features that they want to use and want to engage in, right? And I think you can't force someone to use an app, but if this is something that we want to entertain, you have to have that conversation to say like, what is it you're really looking for out of this app? And if they can, take charge, involved in that decision making, I think that's really important. And again, self-management it evolves, right? Like it changes over time and you want to be on top of things. And these are skills. It's a skill that people will learn and they will learn to adapt. And we have to remember that apps, again, are tools to support, not to replace things that they've already have control of, right? Going back to the piece about medication, if they already have a good control of taking their daily medication and whatnot, doesn't seem right to tell them like you should download this app so that you can do so it will ensure that you're taking your medication all the time. So I would say it's really based off of what the client is really looking for. And how it's going to fit into their, again, that formula of how to self-manage themselves. And that's both for, I know my studies were in COPD, but there is research there to say that it's a similar in asthma. And for any chronic diseases is that, you have to give them that option and in a way that autonomy to really build on their self-confidence, but also their self-management skills.
I'd like to move on now to connecting digital health to patient care beyond app evaluations. You've studied the impact of interventions like asthma biologics in children. How do these pharmacological advances intersect with digital self-management tools for patients and families?
Yeah, that's a great question. My research in app evaluation, I would say, didn't really overlap with that work that I'm doing for asthma biologics in children. However, that's an interesting question because I think this goes back to what we were saying in the piece that there is in a way, the medicinal side of things, like the specific interventions and therapies that is necessary to help with disease management. But then there's another component to it, which is the self-management piece, right? And this is where that digital technology and mobile apps, for me, what I believe is really falls into, right? Because we can give you the medicinal and the pharmacological treatment, but then there are other things, you need to, take charge of as the ones living with that condition, right? So, for example, it's the COPD, right? There's the inhalers that they have to take regularly, but at the same time, some other things to really, be the responsible of the client is to, be motivated to exercise, to ensure healthy eating. These are some of the other things too that is part of that like self-management component. And again, self-management is so important. I couldn't stress it enough, but it's hard for somebody to do self-management if they don't have that education. And I think that's where the digital component can really kind of come in, is that if they need a bit more education and they need that support for education, digital apps and digital interventions might be that solution where, they can, again, choose their own adventure, figure out where they can get that resources to learn more about their disease, especially when you're presenting with an app that is credible and comes from a credible source. I think they can really learn about their disease, why it's important to take the medicinal side of things, but also be mindful why it's important they have to take charge of managing their disease, either through exercising, healthy, in a sense, healthy living, good nutrition, mindfulness, meditation. So some of these things I think are also very important. So there's also non-pharmacological techniques that sometimes may be used in managing chronic conditions. So we talk about like inhalers, but dependent on the type of COPD, because there's the emphysema and the chronic bronchitis. Some individuals produce, for example, a lot of phlegm, right? And there are, again, tools and things that can help individuals to clear that phlegm. It's very important that they clear that phlegm. And then these techniques, you have to learn how to use that technique to help clear the phlegm. And so again, this is probably a place where digital technology can facilitate that. And that's through education. Good information and resources can really help empower clients and patients to learn more about the condition, the techniques and non-pharmacological techniques that they can use to help with their self-management. So I think, again, part of this is a big picture, right? It's not just about, making sure you take only the medication or making sure you're eating healthy. It's about all these things, right? It's we are, as humans, there's many parts to us, right? It's a holistic picture that we have to remember. And digital health can sit in somewhere along there to, help facilitate us to understand that holistic picture, and for clients and patients to know that, like, hey, digital health can really help me understand more about my disease, why it's important to, for example, take the medicine that I'm prescribed, and then why I need to ensure that I am, walking 1 kilometer every single day, or doing these exercises, aerobic and non-aerobic exercises. Like, all these things are very important. So I think it really, again, goes back to, very importantly, like, what is this digital intervention meant for? Is it to monitor them and their habits, or is it supposed to provide them with the education component to them understanding their disease, getting them confident, right? To be autonomous with their self-management. And this is, again, part of the entire formula of figuring out how to manage their disease. And this kind of conversation is definitely something to have with your family healthcare team.
Engaging stakeholders, including patients, families, and healthcare providers, was a key part of your thesis. What insights do you gain from their perspectives on apps and self-management tools?
Yeah, so we talked a little bit about this earlier, but honestly, there are differences in what people wanted. So people with lived experiences, and then people who are clinicians. And so their ideas of what an ideal app it was, what an ideal app is, were kind of different. So, as a clinician, I'm a clinician myself, we're trained to facilitate and help patients and clients take an active approach to their health. But I think it's also just as important for us to remember that before they can get to the active part of like self-management, they need to understand, right? They need to have that passive learning piece to it too. It's two components, right? You need to have a bit of passive learning and also some active components to this. So when I did that study with the stakeholders talking about looking at the public apps and, whether they would use it or not, people with lived experiences, they, again, really liked the component where they can have education and really, pick their own adventure, figure out what they need to educate themselves on. And I think that's really important because it gets them to feel more confident with the knowledge that they have about their own disease. Another one that they really would like, based on what they kind of talked about, was the connection to peers. So either through like a forum or some sort of like a group chat of some sort. I think they were mentioning that that's an ideal feature that they would like, because sometimes when they are talking to each other, it's nice to hear from somebody else who has the same condition that this is, so to speak, normal for them to feel this way, right? And as a clinician, I'm always mindful of this because, like, I know, again, I understand what it's like, right? In a sense that, a person with COPD, they have these respiratory conditions. They have, when they have an exacerbation, this is how it's going to look like. I know the clinical signs. I know the signs and symptoms. I could never say that, like, I totally know what it feels like to be going through a COPD exacerbation or asthma exacerbation. And so to validate those feelings, I think people with lived experience is really important to them, that they're able to talk to peers that have that same lived experiences so that they feel that their feelings are validated. And I think that's very important, right? It's that, again, that loneliness, that isolation that can be really, in a way, very negative, right? It becomes very negative. It gets them into that little black hole thinking like, I deserve this. I did this to myself, which is not the case, right? It is definitely not the case, but we need to, again, remove that stigma when it comes to chronic diseases. And it's really helpful when they have peers, right, in different parts of walks of their life who are, is able to connect to them, right? I think some of them have mentioned during that study that, I think it's really helpful if I got my diagnosis and I knew somebody with, for example, COPD, and they told me that they've had COPD for 5 years and this is what to expect, this is what's going to happen, and this is what it feels like, they would have felt, not as scared. So, having that opportunity in the apps, like a feature to give them the space to really talk to each other, was very important. And sometimes it's just like little tips and tricks is what they said. Tips and tricks are very nice, like, sometimes when I'm going up the stairs, I feel like it's very helpful if I like lean this way versus that way. Like, I couldn't give them that kind of insight, right? So then, people with lived experience gathering together, having that opportunity to talk to each other is very important. But at the same time, people with lived experiences, they really value their healthcare team, right? So the features that they really highlighted when we had this conversation is, education, and then the space to talk to peers, but also be able to get their healthcare team involved. Like, I feel this way. I want you to know. So if the app is, for example, collecting that information, they want to be able to go to their family doctor, for example, and be like, hey, on this day, this is what happened to me, and I want you to feel comfortable. Like, they want the clinician to feel comfortable with that. So that's kind of like the component for features for people with lived experiences. Healthcare providers, on the other hand, they were like, well, education is education, but they need more. They need to be active. We need to have active components. Every day they need to do a questionnaire about their CAT score. So it's a way to assess symptoms. We need to get objective numbers to know what it's really like for them every single day. We need to have motivational pieces, make sure that all the features are actually clinically impactful and that we can assess and, see that there is a real benefit to this. But funny enough, that's not what the people with lived experiences said, right? They are like, I don't need it to be super interactive. I just need to be able to talk to other people and be able to educate myself. And I think that's a stark difference, right? Like as clinicians, we really want to make sure that the things we recommend or provide to our clients are actually useful and worth their time. But at the same time, it's, the simplest of things, which is what they want. And I think that's okay. I think we just need to acknowledge and, accept that and be in agreement. And I think there's a compromise here in a way. We can definitely figure out a way to make sure both sides are kind of satisfied if an app is something that is in the picture. And then when we talked about facilitators and barriers to app use, so facilitators for people with lived experiences is that they want their healthcare team to feel that this is okay, right? So again, that's that collaborative decision making, right? If they want to do this app, they want their clinician or whoever it is that they're talking to feel comfortable with that idea, right? If the clinician is not comfortable with that idea, they're probably not going to use that app to support them. But what if that's something they really want to do, right? And I think those are the conversations we need to have with our clients. If that's really something they want to do, to me, it's great because you're being autonomous and you're making decisions, making informed decisions for yourself, right? So that's like a key piece to it. And then the other thing too, would be a facilitator that people with lived experiences said was that I want an app that's customizable. It's funny because like there's so many apps out there, but it seems like there's no one app that has everything. And then right now there's not, so far as I know anyways, there's not one where it has everything. You can turn off specific ones because they're like, well, I don't know. Maybe today I felt like I didn't need this, but maybe in like 6 months time, I need this feature, right? So I think having some customizable features would be really nice. And in a way, clinicians also said that, that, like, you don't know, things change and, our healthcare plan will change. And it's true. It does change from time to time. And so if we want to integrate that, that's something that needs to be available in the apps. And then clinicians are really, again, would be interested in apps is if there's credibility, right? This goes back to credible information, who made it, the information. That's not a surprise. And I stand by this, like anything that we recommend or use has to be backed up with evidence that we know and is solid evidence. And then the other piece too is that clinicians are interested in how like the mobile apps can kind of be integrated into their like clinical work in a sense like, well, what kind of information can the app like give me so that it can inform the clinical decisions and conversations that I have with my clients. So those are all some like very important things. And as you can imagine, barriers are the usual ones like privacy concerns, like who's housing the information? Where does that information go if we're asking people to input information into the app? And then for people with lived experiences, they're just really concerned about how overwhelming it could be, right? So like some of these questionnaires that ideally would be nice to track every day. It's a lot, right? Like every day, can you imagine every morning you wake up and it's like, hey, it's time to do your CAT score. And please answer these 10 questions. The same 10 questions every day. So I think they're not interested in being overwhelmed. And I totally get that, right? Because then it becomes a burden and then they're not willing to use it. And so those are some of the things that is very important. And then in terms of like, we had a discussion about like, where is like mobile app? Like, how does this sit in our healthcare system and our healthcare plans with our clients? People with lived experience said that like whoever creates apps really needs to talk to us, right? People with lived experiences have that intimate knowledge of what will be important to them. So when companies and researchers, for example, are creating like apps or whatnot, they're like, well, I wasn't consulted and I'm a person with lived experiences. How I wouldn't use this because of A, B, and C. So that's why it's so important for the success of any sort of like intervention or things we come up with. We talk to people with lived experiences. And this is becoming more and more common in this day and age, right? Like Josh, you've been invited to some of our research projects because you have that lived experiences that none of us have, and you can tell us whether it's, well, that's a terrible idea, or if this is a good idea and why it's important to you. To me, it's very important that people with lived experiences, on the same page and is willing to do this. Like, will I be willing to do this? And is this important to me, right? How is that going to inform my life as a person with lived experiences? And so, we have to be very mindful when it comes to mobile apps. It's the same thing. Like if we're trying to consider integrating that into people's lives, we have to ask them what they want, to why they would use it and what they would want to see, or else there's no buy-in, right? I think that's one of the very key pieces. And I think it was also stressed in the clinician group as well. They said that, well, we need to ask people with the lived experiences. It's all nice and all if we have all these things, but I can imagine the things that I want is not the same as my clients or patients. And it's true. A lot of the times it's true. And I think there's, again, going back to that piece with compromise, like talking about like what would work and what wouldn't work and why it's important to include certain things in like an app design, for example. So I think those are some of the very important things that we need to consider when we move forward in this kind of landscape where we're trying to figure out how digital health really fits in the healthcare system, but also with people's self-management plans.
Such a great and comprehensive answer. And, a few points that really stood out to me in that as well is, you mentioned the importance of having peers there. Now, as a severe asthmatic, I can vouch for that. For me, that's what I would look for if I was downloading an app to help me with self-management. Well, I'm going to look for a forum. I'm going to look for a way to chat to other people because we've been through the ringer. And it's also good to not feel alone. And that's something too that's really important. I felt alone for years. And then I started doing what I do on Instagram and supporting other asthmatics whilst they supported me. That helped me out greatly. And, in regards to keeping it as simple as possible, to not overload the patients, the people downloading these apps. I think that's a great point as well, because like we have, wildfire season here in Canada. Air quality matters to me greatly. I'm going to want to know the air quality every single day. So if I have an app that will show me, the air quality, for example, that's terrific, but I'm not going to need that wintertime as well. So a way to customize that, I think is huge. Some tips I would like to point out from our discussion so far in regards to choosing an app for asthma or COPD. Check for evidence or peer-reviewed studies supporting the app. That's important. Look for privacy policies and data security compliance. Extremely important. And use apps really as a complement, not a replacement for professional care, which I think comes first and foremost. And discuss app use with your healthcare provider to ensure it fits your care plan. I'd like to move on now to part 4, which is really broader reflections and future of digital health and respiratory care. Looking ahead, Dr. Quach, how do you see mHealth apps evolving in asthma and COPD care? Are there emerging trends or technologies that you're excited about?
Yeah, that's a great question. And I think that kind of discussion has really evolved over the years. And I think part of it was because of the pandemic. So when kind of the digital health component was introduced into like the research field, you'll see that a lot of the early studies really focused on like whether an app is like clinically effective and kind of replace like for example, a doctor's visit or something like that. But I think over time, over the years, you kind of see that shift in some of the research where they really talk about how it can be more complementary than a replacement therapy as we've been talking about today. Because like, again, like these are not supposed to replace what is already there, but more so to complement and support the overall management, right? And a lot of this really goes back to talking about like digital health literacy, right? There's one thing about digital literacy and then health literacy, and this mobile app is essentially both of that, right? The digital health literacy side of things, like the information that's presented to you, health information, is that credible? Is that relevant? And, being able to read and understand and then critically appraise and then figure out whether this is like credible information is very, very important, or else that leads to misinformation. And this was a big problem as we saw during the pandemic, right? Misinformation can be scary, and we just have to find ways to ensure that doesn't happen. And to do that, I think, again, is really talking about how we can teach people to, read and look at information, because everybody has access, almost everybody has access to Google now, right? No one's stopping you from Googling what's your diagnosis based on these symptoms. But like you need to critically think about this, right? And as a clinician, I think it's very important, and even as an educator, actually, it's very important that we teach people these skills as to how we can take information that we see or has been presented to, and how we can, make informed decisions on it, right? And I think that's the whole point of my thesis, is to point out that like there's just so much information now, right? In this day and age, everything is kind of available on the internet. But it's very important that when you read this information, you have questions, right? You want to be like, hey, is that information actually correct? Is there actually studies to support this claim? Or is there evidence? And is that evidence valid? Right. And I know these are skills that are, instilled in me because I've done all this education. But at the same time, I don't see why we couldn't spend some extra time to talk to people so that they're more informed, right? So like, Josh, you're really well informed on like asthma as well. And I would say you're starting to be much more informed of different parts of respiratory health. And that's because you're taking the time to review and to also critically appraise. And those are the kind of things that we need to think about when we continue to integrate digital technologies into like our day-to-day lives and into like healthcare. And so the topic of digital technology is honestly, it's so big, right? For today's conversation, I really just focused on how digital health can support kind of like patient communication and education. But digital health encompasses many other things, such as clinician tools, but also how it can be integrated into the healthcare system and facilitate the burden of the workload in the healthcare system. But essentially, what my point is for the core of my thesis is really focusing on how, we can get people to be more informed, right? Being informed is better than not. And how can they make decisions based on this informed information that they have so that, they learn from it, right? And I think it's very important that, people are in a way fluid because things will change, right? Information 5 years ago might be slightly different now. And that's how research and science works, right? We're always finding and discovering new things, and that we need to be fluid. And to be fluid, you need to, in a way, be able to critically appraise. And I'm not saying that people need to be able to read a scientific paper and criticize the methods of it, but more so, when you read a news article or you download this app, does this information look right? And if yes or no, like, is this something you want to include in, your self-management, for example? So I think it's very important that as we continue, because I think digital technologies and solutions and tools is here to stay, right? It's been growing over the last couple of years. It will continue to grow. And we just need to figure out how we're going to use it, right? Not rely on it. How are we going to use it to help us improve our understanding, our knowledge, but also the way we deliver information to other people.
For aspiring clinicians or researchers, what advice would you give on blending clinical experience with digital health research to make a real impact?
Yeah, so definitely, even in the hospital, working as a RT at the bedside, there's a lot of advancement in the technology that we have available. And as you can imagine, a lot of discussion now is about like AI and how it's going to replace people's jobs. But AI is, again, meant to support our workload, and it's meant to help us. It's not something that we're supposed to, again, specifically rely on, and they can't do what we can do in the sense that we have the ability to have creative thinking and critical thinking, right? AI doesn't have that capability. And I know some of your other guests on this podcast had talked about AI for that reason, that like AI is only as good as what you feed into it. And that's so true, right? It does not replace critical thinking. Maybe there is a clinical problem that could be addressed by digital solutions. Like, yes, maybe there is a problem and a digital technology or tool can help with that. But then at the end of the day, you need somebody there to kind of manage that, to make sure that, is this tool really being helpful to this clinical problem? And how can we kind of help with that workload and support us as clinicians to make those clinical decisions. And I think digital solutions are nice because they kind of give you that objective perspective, because they're just, usually numbers, and they just state like, in bullet points. But, those are meant for you to kind of think about, and then integrate into your work and to facilitate your process and thinking and critical thinking. It just does not replace creative thinking or critical solutions. You still need to make decisions based off of many factors, but then AI wouldn't have that kind of information. So I guess in terms of like the advice that I would give regarding like clinical experience and digital tools, that like, yeah, I think it's fine that there are possibly digital solutions to help with, some of these clinical problems. But again, it's supposed to support, it's not supposed to replace.
Couldn't agree more, Dr. Quach. Terrific answer. I'd like to move on now to a guest's final thoughts before we wrap up. Is there anything else you'd like to share, perhaps resources for patients, ongoing projects, or guidance for people living with COPD or asthma?
Yeah, so for people who are looking for more information about any sort of health conditions, specifically regarding like asthma and COPD, the Lung Health Foundation has some resources to kind of support individuals who are looking for more information about the disease. And we also have something called the Loop, which is a membership base where individuals with lived experiences can join and have the opportunity to learn more about upcoming information or evidence in respiratory health research, but also, almost like a refresher on some of the things, some refreshers on information and education in respiratory health. Other health organizations such as Canadian Lung Association, Canadian Thoracic Society, Asthma Canada, specifically depends on what kind of health condition you have. There is usually a health organization that you can look to, such as, again, like the Canadian Cancer Society might be something that you want to look into if you have something specific to cancer. Most provinces has their own provincial lung association or foundation, so definitely look out for information from them. So that would be a good place to start. And then I think you talked about like ongoing projects, and so some of the ongoing projects that I have, as I've mentioned before, I really focus on respiratory health, and I keep that umbrella pretty wide for the reason that, being as a respiratory therapist and also having a PhD in rehabilitation sciences, I'm always very interested to see not only just from patient outcome side of things, but also the clinician side of things. So, for example, one of the projects that I'm working on with the Canadian Thoracic Society is looking at professional growth in respiratory clinicians. We did a survey on that, and we're working towards publishing that data. And then again, because I'm a RT at SickKids, I'm also looking at some data in terms of the RT workload and how it has changed over the years. And all that kind of information is very important because that helps us inform, policies and procedures, but also understand how we can support the next generation of researchers, clinicians, and respiratory health advocates, right? So those kind of research is very important. And with Dr. Nonoyama, actually, I work with her with the climate study, which is looking at the extreme weather conditions, which I think is really exciting because the Ontario Tech University has that facility, and we should definitely use it to understand how weather extremes impact people. And then I'm also part of some of the different work groups of the European Respiratory Society, and those work work groups really focus on addressing some of the things that we've actually talked about today about digital health and how it's integrated and used in respiratory health. So that's some of the ongoing stuff. And now with my role at the Lung Health Foundation, I'm interested in doing some of the program evaluation of some of the services and programs that we provide to our community. And as I always tell people, it's scary to have like a respiratory condition because like it affects your breathing, right? And I really rely on people with lived experiences to tell me whether I'm going in the right direction with my research questions and, the time that I spent in creating or, delving into some of these research topics.
Thank you, Dr. Quach. And you had mentioned the Loop earlier on in your answer as well. So that is a program by the Lung Health Foundation where you can find transformative programs, accessible and free resources, and of course, a welcoming community. I will link that as well in the show notes for anybody interested in checking that out. So now, Dr. Quach, for the final question, and it is a philosophical question, so a little bit different. I ask every guest that comes onto the podcast this last question here. Whether you have asthma or COPD, every breath is a gift, a reminder of resilience and the power to manage your health. With that in mind, if you had one last breath, but with it the power to influence the world, what would your message be?
Oh, that's a hard one. It's a good question, though. Well, I think that I have had some very great mentors in my journey to where I am right now. And I think my advice for this would be to be open to collaboration and feedback and to really build trust in these individuals, right? And when I say build trust, it would be building trust with your clinician partners or other researchers, but also in the people with lived experiences. So they may not come with the same academic background, but again, they have lived experiences, and that's something that you probably will never be able to relate to unless you're in the exact same shoes where you get diagnosed with that condition. And so, all these things that we do, I think we always have to think about, well, is this relevant to people with lived conditions, right? Because I think we're going the wrong way if it's not relevant to them. And I think it's always important for us as clinicians and researchers and people kind of leading the direction of respiratory health is that you have to be mindful that sometimes some people don't really understand, the technical and scientific terms that we use and that we really have to, tell them and we have to translate that information, right? It's not that sometimes people with lived experiences, it's not that they're not interested. It's sometimes they just don't understand these words. And that's okay. We just need to figure out how we can relay that information until they're at that point where they understand it better with all these technical terms, right? So, for example, when I talk about, and sometimes I think that's a pretty relatively health term that I try to avoid using, but it's really like a flare-up, right? It's a flare-up. It's something that's triggering you to have symptoms or make you feel unwell, right? So I think that's kind of like my advice is that we have to be open to feedback and collaboration, and we have to trust the people that we decide to work with, especially the people with lived experiences. They have valuable opinions and they have valuable insights. And I couldn't stress that more. And this is why whenever I have like a question related to COPD or for asthma, I have to ask my patient partners or ambassadors essentially, like, is this important? Do you think this makes sense? And I know, Josh, we definitely have reeled you in some of our work, and this is exactly why we do it, because how else are we going to, sell it in a sense that, to tell you that it's important.
It's my pleasure, and it helps me feel like I'm playing my part as well. Thank you so much for sharing your insights and expertise on digital health, mobile apps, and respiratory self-management. Your research sheds light on both the promise and limitations of current tools and will help guide safer and more effective interventions for people living with asthma and COPD. To our listeners, if you found this episode helpful, subscribe, share it with those who might benefit, and check the show notes for links to Dr. Quach's research, her PhD thesis, and practical resources for app-based self-management. Until next time, keep pushing forward, keep breathing deep, and never let anything hold you back. Thank you for listening to Beyond the Wheeze. If you enjoyed this episode, don't forget to subscribe and share. Follow us on Instagram at Beyond the Wheeze, and or follow me at the Asthma Runner for more updates. Keep breathing strong, and remember, your potential has no limits. Until next time.